Chapter 32. The Skin 2. Injuries to the skin. Here's an extract from a medical website. Mechanical injuries to the skin are divided into those caused by blunt force, such as punch for a fist, and those caused by a sharp force, such as knife. Injuries from blunt force and abrasion, also called graze or earth crash, is a superficial surface injury involving only the epidermis, which has been removed by friction. A scratch is linear, as in fingernail scratch, whereas a graze involves a wider area, as in abrasion caused by dragging part of the body over a raw surface. A contusion, also called bruise, is an injury that occurs when blood vessels in the skin are damaged. A laceration, also called a tear, is a wound involving both the dermis and epidermis. It is usually distinguished for penetrating or incisive wound by its regular edge and relative lack of bleeding. Injuries from sharp forces and incised wound are also called cut. It's a break in the skin where the length of the wound on the surface is greater than the depth of the wound. For example, a wound caused by a razor blade. The depth of penetrating wound is greater than the superficial length of the wound. For example, a stab wound caused by a knife. Case report. Read the case report and compare it with the illustration. Case 2. A 9-year-old boy presented to the accident and emergency department after he stumbled and fell while running in a wood. He had received a blow to the head from a rock and had been scratched by bushes. On examination, a vertical laceration 1 centimeter long was noted on the bridge of his nose, just right in the midline. There were a number of superficial scratches on the right side of his forehead. His right upper lip was badly contused. Sores. The word sore is a popular term for many different types of skin lesions, especially infected lesions. A pressure sore is a skin ulcer caused by pressure, for example, the pressure of lying in bed for long periods, also known as bed sore or the cubitus ulcer. A cold sore is a lesion caused by herpes simplex. Exercise. Write the corresponding medical term for the ordinary English word. Common word: bruise, cut, graze, scratch, stab, wound, tear. Medical term: type of force. Choose the correct words to complete the description of the injuries shown in this illustration. Look at David's opposite to help you. There are scratch graze above the left eyebrow and the left side of the neck, a contusion laceration to the left side of lower lip, and tears to the left cheek, or cuts. Write a description and the injury shown in the illustration. Complete the sentence. Look at ABC opposite to helping. Frequent change of position are necessary in the immobile patient to prevent the development of abrasion. He had several wounds in the abdomen from the knife. He had knocked unconscious by a heavy to the head. The wounds were only and required no treatment. Chapter 33. The urinary system. Urinary symptoms. Urine is formed in the kidneys and stored in the bladder until it is passed or voided. Patients may say, "I have some pain when I pass water or pee." Doctor may say, "Are you having any trouble with your waterworks?" Doctor, "Are you having any problem with your waterwork?" Mr. Young, "Well, I do have seem to go to the toilet more often than I used to do." Doctor, "How often is that?" Mr. Jones, "It depends, but sometimes it's very hour or even often." What about at night? Do you have to get up at night? Yes, nearly always 2 or 3 times. Doctor, do you get any burning pain when you pass water? Mr. Jones, no, not usually. Doctor, do you have any trouble getting started? Mr. Jones, no. Doctor, is the stream normal? Is there still good flow? Mr. Jones, perhaps not quite so good as it used to be. Did you ever lose control of your bladder? Any leaking or dribbling? Well, perhaps a little dribbling from time to time. Have you ever passed blood in the urine? No, never. Common urinary system and their definitions. Frequency: frequent passing of urine. Dysuria: burning or scalding, pain in the urethra when passing urine, nocturia, urination at night, urgency, urgent need to pass urine, hastency, difficulty straight to pass urine, urinary incontinence, involuntary passing of urine, hematuria, macropis, blood in the urine. Urinalysis. Urinalysis is the analysis of urine. Simple screening tests of the urine are carried out with reagent strips. For example, clinitis for the detectation of glucose. More detailed tests are carried out in the laboratory on specimens of urine. Typical specimens are mixed specimens and catheter specimens. Microscopic examination may reveal the presence of red blood cells, pus cells, or casts. Casts are solid bodies formed by proteins or cells. Plus signs are used in case notes to indicate a normal finding. A small amount plus is described as a trace. For a large amount, the word gross or may can be used, for example, gross hematuria. When there is nothing, the word nil is common. Sugar, nil, protein, plus, blood, plus. There was no sugar, a trace of protein, gross hematuria. Look at the conversation in opposite and complete the notes about. CON for 1 year, no, or a little weaker, no incontinence apart from occasional. Match the patient description of their symptoms. Have to pee every half hour, so I get scanning pain when I pass water. I have to get up several times to pass water at night. I have to rush to go toilet. I have trouble getting started. I can hold my water. I pass some blood in my urine. Dysuria, frequency, hematuria, hesitancy, nocturia, urgency, incontinence. Write the doctor equation for each symptom 32.2 above. Describe the finding of the laboratory report in words. Blood plus, protein plus, gas nil.